16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
A healthy lifestyle not only changes your body, it changes your mind, your attitude and your mood. Very good evening viewers. Welcome back to yet another episode of BMC Global Live Hilal Health World, taking tiny steps towards creating a healthy world. Myself, Mareena Francis. In today's episode of Health World, we will be talking about stone diseases. It is becoming an increasing health concern around the world, and I feel that we do not have a proper understanding of what stone diseases are and how to handle them. So that is what we will be discussing in today's episode. And I'm happy to once again welcome to Health World episode Dr. Shabeena Naz. She is a female urologist with over 3 years of experience in urology related diseases. She is currently working at Al Hilal Hospital, Mohrak branch. So let us move ahead with today's episode. Good evening, doctor.
Good evening.
Thank you for joining with us once again.
Thank you so much.
So once again, welcome to Health World. So in today's episode, we have taken up stone diseases as our topic.
Yeah.
So what exactly is stone in the urinary system?
Stone is actually a hard substance, or you can say object in the urinary tract, anywhere in the urinary tract, kidney, ureter, bladder, urethra. and these stones are formed because of the substances you can say, or the chemicals which are present in the urinary tract, like the calcium, oxalates, xanthines, urates, phosphates. And normally these substances are soluble in the urine, but when their solubility products increases, they aggregates to form the crystal, and crystals then aggregates to form the stones. And you can also say some things are in excess in stones, in urinary tract, and other are deficient, so this leads to the formation of stone.
Okay. So doctor, we have commonly heard of kidney stones. So what are all the types of stone diseases?
Kidney stone or urinary tract stone or urolithiasis can be classified according to the composition of the stone, appearance on the X-ray, site and size of the stone. And for the understanding, it can be divided into calcium containing stones and non-calcium containing stones, like uric acid stones and struvite stone or triple phosphate stones or xanthine stones. But for the treatment purpose, we divide them in according to the site of the stone: kidney stones, ureteric stones, bladder and urethral stone, and furthermore the upper pole, mid pole, lower pole, like this.
So doctor, what causes the formation of the stones, or what are the risk factors?
There are certain risk factors associated with the stone formation or urolithiasis, and some are environmental one and other are internal, associated with the person itself. And like the gender, male gender is more prone to get the stone disease. It's like 2:1 ratio, men to women. And the other is age. The stones are more common in age of 20 to 50 years of age. And others are genetics, like Caucasians and Asian people are more prone to get the stones. And also the people with these stones, they have underlying causes, different causes, like urinary tract malformation, underlying metabolic abnormalities like renal tubular acidosis, cystinuria, and also the other comorbidities like diabetes, hypertension, obesities, and hyperthyroidism. The patient taking the medicines for the cancer purpose, malignancy, like chemotherapeutic agents, patient taking the steroids, and also the gout, and the patient with the kidney cystic diseases, and these can these people can have stones. And other are like environmental, which affects the person's life, like geographical location or season. Like here in the Middle East, hot climate, and other lifestyle. If the person is obese and having sedentary lifestyle, and having sitting position throughout the day, and they get more stones. And the other is dehydration. If your fluid intake or water intake is less than 1200 ml per day, you are prone to get the stone. And other is your eating habits, like if you are taking increased amount of animal protein or taking increased amount of the salt, you can say added salt, they can also lead to the stone formations.
So as you mentioned about salt, so what are the foods that can cause stone diseases?
And there are a lot of the foods that can lead to the stone formation, like food containing high quantity or high concentration of the oxalates. Oxalates are present in spinach, beetroot, sweet potatoes, potatoes with skin, zucchinis, okras, nuts, almond, cashews. These foods are high in oxalates, and if you are taking high salt, added salts, and the canned food, and increase animal protein like the eggs, meat, and fish, and also the processed and canned food, because they have phosphate in it, they can lead to the phosphate stones, and an increased amount of vitamin C. If you are taking increased amount of vitamin C, it can also lead to the stone formation.
Okay.
Yeah.
So doctor, you spoke about the foods that can cause, can stress also cause these stones?
No, stress can't cause the stone disease directly, but it may lead to the stone formation, like it changes your eating habits, it's changing your lifestyle, so you can get stone. If your lifestyle becomes sedentary and your eating habits are poor.
Doctor, so in your practice, what do you say, how common stone diseases are?
Stone disease is very much common these days because of the eating habit and lifestyle of the population. Every year, 500,000 people visit the emergency room for the stones and the colics. Every 1 in 10% get the stone somewhere in his or her life. And once you get the stone, and if it's calcium oxalate stone, there are chances of getting 10% stone in the next 1 year, and nearly 27 to 50% stones in next 10 years. And if there is second recurrence occurs, stones become more frequent.
Okay. So we have only got to know about basics of what stone diseases are. We need to know how they are treated as well and how to prevent them, but we will be back after a very short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live Hilal Health World. Nothing but lifestyle. This is an exclusive health talk with doctors from Hilal Hospital. Myself, Mareena Francis, and today talking to us is Dr. Shabeena Naz on the topic stone diseases. So doctor, next I would like to ask, what are the symptoms that a person with stone diseases will show?
Stone disease or urolithiasis can be symptomatic, or you can find it incidentally when you are investigating the patient for other problems. But if the patient gets symptoms, the symptoms are pain in the lumbar area. Sometimes it's hematuria, which can be microscopic or macroscopic. And some patient present with the recurrent UTI, like the patient with struvite stones or triple phosphate stones. And sometimes the patient present with the complication like pyelonephritis, pyonephrosis, abscess formations, and urosepsis.
So doctor, once the patient comes with some symptoms, how do you diagnose that it is stone diseases?
Diagnosis starts when the patient lands in your OPD. We inquire about the symptoms and the other detailed history regarding diet, lifestyle, occupation, family is a history. If the patient is having stone disease in the past, if patient have any inflammatory bowel disease, or patient has undergone any intestinal surgery in the past, these also are the risk factor, and we have to ask about them. And then the physical examination for the patient, and definitely then the investigation. Investigation start with the urine analysis, and we see it for the pH, because some stones forms in the alkaline pH of the urine and other form in the acidic urine. and then the urea, creatinine, electrolytes, and then the radiographic investigation like X-ray, renal ultrasound, and then more advances one, the CTKUB, CTU, MRU. But we do all the investigation to locate the stone, because this treatment is different for the different kind of stones.
Okay. So you said the treatment is different when the location is different. So
Yeah.
how do we proceed with the treatment? How's the treatment?
First we locate the stone where it is, and then we go for the treatment options, as we have a lot of different options for the treatment of kidney stones, uretary stone, bladder stone, and urethral stone. For the kidney stones, we have choices of ESWL, uteroscopy, RRIS, and PCNL, and laparoscopic removal of stone. And for the and no doubt the open surgery too.
Okay.
And another one is for the uretary stone, we go for the endoscopic surgery, URS, which is, and then the bladder for endoscopy and urethra for endoscopy mostly.
Okay. So doctor, can stones be treated with medicines?
Stone can be treated with the medicine if they are recurrent stones, and you have done metabolic workup. Surely in the investigation we also do the metabolic workup. If the patient comes again with the stone, our patient is a child, we go for the metabolic workup too. And it's very important to do it. And when stones are recurrent, they have underlying uric acid stone or cystinuria. We use alkalization medicine, and it can be treated with the medicine, but the treatment is according to the site and size of the stone. And some stone can be treated medically, you can say it conservatively, and other can be treated surgically.
So doctor, as you were saying, can children also get stones?
Yes, children can get the stones, but most of the time the stones in the children is because of underlying malformation, urinary tract, or they having any metabolic abnormality in their system. But again, the pediatric urology is totally different, and we prefer children should be treated by the pediatric urologist.
So doctor, I think most important question would be, how can we prevent these stone diseases?
Yes, it is very important. For the prevention purpose, you have to modify your lifestyle, and you have to modify some food. You should use balanced diet, avoid taking too much salt, too much added salt, adequate amount of the water. Your urine output should be more than 2.5 liter per day. And you should take vitamin D and vitamin C after your doctor prescription only. And you should take high oxalate containing foods with the calcium containing foods, and avoid processed meat, processed food, avoid taking so much animal proteins, and you also do regular exercise.
So doctor, I think we have covered almost all aspects of stone diseases. So what would you like to tell our viewers as a takeaway message in today's episode?
The takeaway message will be, please balance your diet, balance your life, and if you get any symptom, please do visit your doctor so you can properly diagnosed and properly managed.
Yes. Thank you very much, doctor, for joining with us once again, and again coming up with a very relevant topic. I definitely hope that this episode was quite informative for our viewers. Stay tuned to BMC Global Live for more such informative programs. Until then, this is Mareena Francis signing off. Stay happy, stay healthy. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome